Your question, the member from Elgin, Middlesex, London.
Speaker, my question is to the Premier. Speaker, the Liberal government has waged an ongoing battle with Ontario's doctors. Many times they've created the illusion that doctors' billings equal their take-home pay. Instead of working with doctors, time and again the Minister and this Premier have unilaterally cut patient services and attempted to blame the doctors for this government's own mismanagement. Speaker, with the OMA present here today, will the Premier stand up and apologize for her government's treatments of doctors in this province?
Minister of Health and Long-Term Care.
Minister of Health, Long-Term Care.
Mr. Speaker, I'm greatly encouraged that a number of weeks ago the OMA named a new negotiating team for themselves. Shortly thereafter, the government named its new negotiating team. The Premier and I expressed our commitment that the first order of business as part of negotiations, of that first episode of sitting down at the table together, that episode that took place last night, Mr. Speaker, for the first time, that the first order of business would be to agree on a process for binding interest arbitration. We're confident with this renewed spirit of collaboration, with the commitment that the Premier and I have made, with the quite frankly, the talented and committed individuals at the table. I think both Ontarians and the membership of the OMA can be satisfied that we have the right people at the table, I believe, to truly work together on this challenging but attainable task, Mr. Speaker.
Thank you. Supplementary.
Thank you, Speaker. Back to the Premier. Speaker, where was this talk 3 years ago before they started the vilification of doctors? Why weren't they doing this 3 years ago? Mr. Speaker, recently it was revealed that the government created their negotiating strategy through polling and not what was in the best interest of patients. Everything they did through the media was calculated to sway the public's opinion against doctors. Instead of working with the OMA to find a solution to benefit patient care, this government spent money on polling and devised schemes to vilify the profession. Speaker, according to the Financial Accountability Officer, this government will need to cut an additional $2.8 billion from the healthcare system. Is this Premier going to base her decisions on current polling numbers or work with the frontline healthcare professionals to make the best decisions based on patient care?
Thank you. Be seated, please. Be seated, please. Thank you. Minister.
Well, Mr. Speaker, that question had so many parts to it. I think it's easiest. I'm going to go back to the initial question from the Leader of the Opposition, where he referenced wait times in this province, and he referenced the Kai report that, indeed, I know he cherry-picked from it. There is more work to be done, but hip replacements, 85% of Ontarians have their hip replacements completed within the medical benchmark, 6% higher than the national average. Knee replacements, 12% higher than the national average. 99% of radiation therapy within the medical benchmark. The lowest wait times for MRIs, CT scans, the shortest wait times from GP to specialist, from specialist to treatment. On average, Ontarians are receiving care more than 4 weeks earlier than the national average. We have some of, if not all of, the shortest wait times in this country, Mr. Speaker. Wait times for general surgery have gone down by 13%, for medical oncology down by 39%. We have done this, Mr. Speaker, because of our doctors, because of our nurses, because of all those healthcare practitioners who work so hard.
Be seated, please.